Hi, everybody. Just wanted to give an update on some COVID data, also a vaccination update as well. Uh, we'll have today's Tuesday, so we'll have a regular briefing Thursday. We may do another Facebook Live tomorrow. Uh, but let's go through some of the data. We unfortunately lost one neighbor over the last 24 hours. She was 94 years old, and certainly want to continue to think about those we've lost, their families, and keep them in our prayers. It's just very sad. Uh, when we look at new cases, today's a good day. Under 100 for the first time in a period of time, 91 new cases. So that's nice. Our 7-day average dropped down a little bit to 2.9%. When we look at active cases, they are down to 2,034 active cases. So things related to cases are going in the right direction. We're at a pretty low rate right now. It will be interesting to see how much lower we can go, being that these conditions are good conditions for COVID, regardless of our actions. I think we still got some more room to grow, but certainly we knew during the winter months when people are indoors, activities indoors, that we would have elevated cases. We were thinking in the 100s during the winter months, and now we're, at least for today, we're below it. So certainly the community should be really happy with the progress that we've made over the last 30 days. Looking at hospital numbers, 125 in the hospital. That's basically where we were yesterday. Each day we have new admissions into the hospital, but we also have folks that get better. So that's something that it's not like we're just one or two people in and out of the hospital. 13 new admissions into the hospital over 24 hours. It just gives you the proper context that people have a hard time with the virus and people can get very sick. Our hospitals have just gotten so much better at treating it, and we're very lucky that that's happened. We've actually had over 2,200 hospital discharges in this pandemic. Think about if our hospitals weren't as good at what they do, how much worse these death numbers could be. 31 neighbors in the ICU. Please keep them in your thoughts, in your prayers, as certainly they're having a very, very hard time. They have a fight on their hands here, so let's just be cognizant of that. Going into the vaccine, let's go through a couple things. Today we learned that the governor is giving local governments the discretion whether or not to vaccinate taxi drivers, restaurant workers, and the developmental disabilities. We've been targeting our neighbors who qualify by age in congregate settings for developmental disabilities. Here's the challenge. That's our call. I'm not ready to make a call yet on this. I need more data from all parties vaccinating in our county. I need a better understanding of how many people are still eligible after this week that haven't received the vaccine out of some of these subcategories. How many folks do we think just aren't going to get the vaccine right now because they're comfortable before we bring more demand on? Last week, when we had our vaccination registration day, you had a 1.4% chance of getting an appointment. 1.4. That means over 98% of you were upset that you did not receive one. That's a direct supply issue. So bringing on more people when the supply is just increasing by hundreds of doses in a week, we really need to understand where we are before we do that. So we'll take the next week to the new supply doses didn't come this week anyways. They would be next week. So we're going to take the week to understand where we are with teachers, where we are with law enforcement, where we are with our congregate settings, how much progress have we made with seniors before we commit to new individuals for eligibility. Because the last thing I need to do is make a bad situation worse. meaning that 1.4% have a chance at an appointment this week, that percentage is even less next week because we brought in another 10,000 people who are eligible. We will reach out to employers in the restaurant industry and the hospitality space, as well as union members, to get an idea of how many employees we're talking about here in Onondaga County. We got to make data-driven decisions, and that's what we're going to do here. Again, the capacity that the governor talked about with new vaccine today, we don't even have it yet. So there is no new capacity right now. So I think that's where we are right now. I learned about this today. We're not ready to make that decision until we understand the data. Related to vaccine this week, 2 pop-up clinics. The state of New York brought us vaccine for 2 pop-up clinics in communities that have not been proportionately getting vaccine. One of the things we're looking at Thursday, I'm going to go over data related to our pod, but we look at these factors with the vaccine. We look at race, we look at age, we look at sex, and we look at zip code. We then try to look at proportionately what percentage of the population do those demographics meet. And when we're falling behind, we are absolutely going to intentionally try to vaccinate those communities. So right now, we could tell you from our pod, in some of our minority communities, things were falling behind. We have strategically and intentionally brought the vaccine to these communities, and we will go through all the data on Thursday. And based off of that data, if there is a rural community that's falling behind, we will adjust and we will make sure that nobody falls behind. There will be equity. So that's just, we'll talk about that Thursday. I haven't even seen the data. So we'll know Thursday if we're doing well, where we need to still do better, and we'll talk about that as a community so everybody understands. But tomorrow, a pop-up targeted clinic in some of our new Americans, our new citizens, some of those organizations that we focused there. Also, there's plenty of seniors being vaccinated as tomorrow as well. New appointments for this week. If you are on list, please check your email beginning at 9 a.m. tomorrow. If you are selected, you will get an email for new appointments this week, and then the email will give you directions on how to secure the appointment. We will check the on-list emails to see who's opened them. We will utilize our phone bank to call folks as well, but we really, for the sake of speed, checking your email on-list is important, but we do use our phone bank to call seniors as well to try to make sure they get their appointment. Thursday or are we doing this tomorrow? We're doing it tomorrow? 10 a.m. tomorrow? Yeah, tomorrow at 10 a.m. We will open up the link for 630 new appointments on Thursday. You see the confusion. I was getting tomorrow's link and Thursday's vaccination clinic confused. So tomorrow, 10 a.m., 630 appointments will be opened up for a Thursday clinic at the On Center. We will be doing a small clinic on Friday for our residents who have developmental disabilities from congregate settings. So that's important. There's a lot of things going on. We get a lot of questions. Remember, children at this point are not allowed to receive the vaccine. And so that's once children are allowed, we'll let people know that, but we're getting a lot of folks with some of our children who have developmental disabilities if they can receive it. The answer is right now, no, they cannot. Again, with the vaccine, Onondaga County, where do we stand in this? What's our role? What's my role? So we do not determine eligibility. The state of New York does. The state of New York today did say if we wanted to start doing restaurant workers, taxi drivers, and developmental disabilities from congregate settings, that we could. So that's the only discretion we've had to date in any of the eligibility. I'm not ready to make a call on the restaurant workers or taxi drivers yet. We have been vaccinating folks with developmental disabilities from congregate settings. So we'll work on that. The when is when you have supply. We receive supply today, so we will do a clinic Thursday and a small clinic on Friday. And the how is through our pods. And when we look at our pods at the On Center, when we look at the pod at the fairgrounds, when we look at the pod at Kinney Drugs and other drugstores, that's the how. So looking on list, by the way, the 10,000 slots on list are now full. On list is being pulled from now for appointments from our partners, so that when we say check your email for on list, that means out of the 10,000 there are slots being pulled from randomly, and those individuals will then get vaccinated. For example, today there was some slots available in today's targeted clinic. We pulled from that zip code from on list. Some of those seniors in that neighborhood went and got their vaccine. So these are things that we're doing. We will get to everybody. And our job won't be done until everybody who wants a vaccine gets their vaccine. Supply still is an issue. When the state talks about increasing our allotment by 20%, we don't know if that's off of our 1,200 that we got this week. We'll get 20% more, or is that off of the 3,600 we were getting before they got cut? That hasn't become clear. But once we know we have vaccine, we schedule clinics and we get rid of the vaccine within a day or two at most. So we'll continue to do that, and we'll continue to keep the community briefed on all this. And again, we may do one of these Facebook Lives tomorrow, but if not, we'll see everybody on Thursday.